moment to breathe, grab a beverage or two. We got professional guests with lots of stories for you. So take a seat right here and join us on Careers Over Beers.
Alrighty, folks, welcome to Careers Over Beers podcast. Today, this episode is sponsored by New Way Cafe. Thank you so much, New Way, for being a sponsor and giving us some root beer. They gave us 2 frosty mugs to drink it out of as well, and some coupons, or some gift certificates, I guess. 2 New Way combo meals, so I'll give you one of those. Yeah.
Sweet.
If anybody listening wants to get a New Way combo meal pass, you can comment on my YouTube video or my Facebook post, and I'll reach out to you and get you one. So New Way is one of the oldest restaurants in Wichita, established in 1930. They make those delicious crumbly burgers and big golden onion rings, and then they make all of their root beer in-house. And that's what keeps us all coming back, that delicious root beer. So shout out to New Way. Thank you for being a Wichita staple for so long. If you're in the Wichita local area, you can find New Way and pretty much anywhere in town. West Side, downtown. The original location is downtown. So once again, thanks, New Way. And you wanted to drink root beer today.
Yeah, absolutely.
So we're drinking New Way root beer on the podcast.
Very cool.
Go ahead and pour me one here. What's your favorite root beer?
I'm gonna go ahead and say New Way.
New Way.
Yeah.
That's the right answer. And you weren't even paid to say that or anything.
No, I wasn't.
What kind were you expecting, though, whenever you posted that you wanted to drink root beer on here?
You know, just your generic variety. Your what's that one? The one that starts with a B, or your
Bargs?
Yeah, that one, or the bulldog on the front, whatever.
Yeah, mug.
Yeah.
Yeah,
There you go.
A&W.
Yep.
That's another one. So, all right. Well, today I'm interviewing somebody that works in one of the hardest jobs probably out there, but I'm sure it's very rewarding.
It is. Yeah, absolutely.
Go ahead and introduce yourself and tell us who you are.
I'm Katelyn. I'm a hospice nurse. So yeah, I've only been doing hospice for a very short period of time, relatively speaking, about a year and a half. But something I'm really passionate about. It's an important job, and I think people should talk about it more, and that's kind of why I got into it. You know.
Yeah.
So yeah, that's what I'm here
That's
to tell
great.
you about.
Yeah. Cheers to you.
Yeah, thank you.
Oh, yeah.
Mm.
There really isn't better root beer than that.
No, homemade.
Honestly.
You can't get better.
Homemade, in-house, every day. So, Katelyn, you are a hospice nurse, but you started out as a regular nurse, I'm assuming.
Well, of course, yeah. So my kind of medical background experience was primarily when I was in nursing school. I worked in the ER at Wesley, so that was a cool experience, very educational. And then as soon as I graduated, I started in as an ICU nurse, and I was at St. Francis, and that was good, but I actually only stayed there for 3 months, and not because I didn't like ICU. It's very fascinating work. It's definitely a wonderful job for someone, but I realized pretty quickly that it wasn't for me.
Why is that?
Well, because, you know, honestly, I had a lot of patients where I was having this realization that what they were going through, they had maybe a good chance of recovering, some of them, and then a lot of them not. And those who didn't have a good chance, if they were going to make it out, they certainly weren't going to make it out with the same quality of life.
Mm-hmm.
And what I noticed above all in those situations was that we weren't really talking about that. We were just focused on the here and now, and saving their life. In a sense, for me, it felt like at all costs. And so I was seeing, you know, a lot of loss of dignity, and we weren't really preparing people and their loved ones for the outcomes that could be happening to them, and often did.
Mm-hmm.
And I felt like that conversation I just needed to dig into that conversation, and then I did have some patients pass away, and honestly, I felt like in some of those cases I was doing more for some of those patients and their families when I was able to give them comfort and peace and help them in that situation, in those moments, than I was when we were just really throwing stuff at the wall and hoping it stuck. Do you know what I mean?
Wow. Yeah, that's very interesting, actually. I've never really heard that perspective on it. But what you're talking about is more like a corporate business model where you're getting them in and you're getting them out, and that's all you're focused on, just, In
a way, yeah. I mean, honestly, I hate to say it, but that's kind of the focus of health in America. In my perspective, I think nobody wants to talk about death. No one wants to even refer to the possibility of it happening. But the truth is, it's going to happen to all of us.
Right.
We're all going to meet that outcome at some point. And so if that outcome is coming into view, then we can have a conversation about it. I think it's absolutely necessary, and it improves the outcome in the long run.
Yeah.
You know what I mean? You do have some control in many situations over how you die and what level of comfort you have and how your family feels and what you're able to do in that time span where you're kind of accepting of this, if you've been diagnosed with a terminal diagnosis, you have some time to have cherished moments.
That's deep. That's crazy. Just think about that. It's inevitable that we're all going to die.
Yeah.
And I think people like to avoid that thought, and they avoid the conversation that you're having right now about that actually happening, because anytime you bring that up to somebody's loved ones, I'm sure at first they're really resistant. They're like, whoa, that's not gonna happen to me.
Definitely.
That's not gonna happen to my parents.
Mm-hmm. Yeah. No, it's a scary thing to think about for yourself and for your loved ones, because I've said this to people's families a lot, that we grieve selfishly. We don't want people to leave us for many reasons.
Mm-hmm.
But eventually you do come to kind of a point of acceptance where that person's comfort is more important than your own grief, and it's difficult.
That's unfortunate for people that don't see it that way, because they're looking at it selfishly, like you said.
Sure.
And you can't really fault them for that, because nobody wants to lose somebody that's loved. But at the same time, it's like, do you want somebody to keep suffering for your own good or your own pleasure? I mean, to have them in your life.
Right.
And that's a tough one.
It's really hard to get past. And I think there's a lot of reasons why people don't ever get past it sometimes.
Yeah.
So I certainly don't fault people for that. And I always tell those people I think it's very brave to have a conversation about hospice. Honestly, I tell people that. I think it's very selfless just to even be able to sit in that room and in that space and talk about it and say, we want what's best for our loved one, and we just want them to be comfortable and to pass peacefully and all these things. And it's a very scary space, and it takes a lot of bravery in my eyes.
Yes, agreed. And also for people out there that don't really understand what hospice is, you're basically taking them off all life support, and you're just giving them comfort care until they either die or recover on their own.
Yeah, basically.
So you're not really you're not giving them meds, you're not keeping them on a ventilator, you're not artificially keeping them alive anymore.
Well, so artificially keeping them alive anymore, yes, that's a good way of putting it. There's different settings where hospice is carried out, right? So there's home hospice and there's inpatient hospice, like in a hospital or in a hospice house, like a facility that's centered around hospice. And I've done a little bit of both. I've actually done inpatient hospice for the majority of my time in hospice, and that was in the hospital, and my job was essentially taking people off of life support, which is exactly what you were just saying. And it's in very acute situations. It's sometimes very unexpected. It's people of all ages. It's
such a crazy job to have. Yeah. Your job is to take somebody off of life support.
Yeah.
That's crazy.
Yeah.
Yeah. I mean, your lives are literally in your hands.
I mean, they are, in my mind, the most important thing in that moment is just to shed some light on what's happening for the family while they're watching this happen, and to make sure that that patient is comfortable as it's happening. Because at that point, we've accepted that the inevitable is incoming.
Mm-hmm.
And it's time to make sure that it's peaceful. So it's always pretty difficult in the hospital, I think, because those are typically the ones that are unexpected. And usually the patient is not awake and alert enough to choose that for themselves.
Right.
A lot of times it is the family who is choosing that, choosing to take off life support or choosing to take away whatever aggressive measures are being given. And sometimes it's even, a 19-year-old kid making that decision for his dad.
Ugh.
You know what I mean? So
It's awful.
yeah, it really is.
It's awful, but
someone has to be there to, you know.
What if somebody doesn't have any family at all and they're not conscious to make that decision? Do you guys have to keep them alive as long as possible, or does somebody at the hospital in the hospice setting make that decision?
So there are routes to kind of help make that decision. Hopefully they have made some arrangements prior to that situation. Obviously, if there's going to be social workers involved, there's going to be some effort, quite a bit of effort in finding someone who would be the primary decision maker for that patient.
Yeah.
I've had to work with social workers at the hospital, Googling people before and trying to find family members
Just
across
trying to search
the country.
their history, like they might know this person. Let's call them.
No, really.
And then you call them up and say, "Hey, are you cool with us pulling the plug?"
Well, I mean, I'm not usually in that situation. I wasn't usually the one making that phone call. The doctor is the most appropriate person, I think, to make that phone call, obviously. Yeah. And verify it. Usually there's social workers and case managers in the hospital who will try to find that next of kin person, and the doctor sometimes makes those efforts as well. And then it's important that they have a conversation with the doctor and get the information to really make an informed decision, because you can't make a good decision without information, obviously.
Yeah.
So, yeah.
It's just a weird circumstance to be in, because it's modern. It's like very modern that we get to even do this at all and take people off life support and make those decisions, because throughout history, I mean, you just kind of
happened
over, Yeah.
Yeah. Well, I mean, I think hospice nursing is definitely older than the modern, medical technology.
That's true.
But definitely very different. It's very evolved today into a different breed.
Yeah.
But
I mean, we're very lucky to have it, in my opinion. That the fact that we can.
I hope I have a hospice nurse someday.
Exactly.
That's part of why I do it. I get up and I say, well, I may not feel like doing this today, but I want someone to do it for me. So.
Do you ever have to deal with patients that are afraid of dying, or they're very resistant to accept the fact that they are dying?
All the time.
Really?
All the time.
How do you deal with that?
I mean, we have a whole interdisciplinary team involved in hospice. I've done some of the home hospice too, and it's wonderful because you've got your social workers, your chaplains, you have volunteers. We even have pet therapists that come in with their pet therapy dogs and stuff.
Hey, that's good stuff.
Yeah, and you work with all of those people. Everyone's having conversations and trying to build rapport with those patients and try to allow them to open up and talk about it, because we are a third party for them to talk to that's not family members who are going through grief and denial of their own. And so I think it does make it easier for them to start opening up and accepting what's in front of them. But not everyone does. And when that happens, they go through a lot of anxiety. And we just try to, if medication helps, we'll do that. We look for a lot of different ways to help manage that. So.
Have you ever seen somebody that's just in total denial and then all of a sudden it clicks and they realize, like, this is it? Do you ever experience moments like that?
I'm trying to look back in my memory bank. I seem to see two different scenarios in my memory right now, and that is people who are in denial all the way up until the end, and then those who are that at some point reach a point of acceptance. Usually it's not quite right before. And I have some theories on why that is. I think, and other hospice nurses have written about this too. I think that when people get close enough, this might sound crazy, but it's almost like they are both here and there at the same time, and they really start to realize it's something that their brain, and I mean,
like they're crossing over into a different dimension or world or afterlife or something of that sort.
I'm not sure if it's that or if it's just the brain and the biology realizing that it's shutting down. You know what I'm saying?
Yeah. That is something that I think that I've read about in nature that happens, is that animals especially will know when they're dying, and their body has a response to that. And whether that's like just pumping out the body's own painkiller because you see deer getting eaten alive by some coyotes, right? It's just chilling there, just looking around. I mean, it's obviously not. Yeah, there's something happening there probably in the body where it's like, this is it.
Yep.
And we're going to make it as comfortable as possible.
I absolutely think so.
Yeah. And so you would think humans got to have something of the same.
They definitely do. There's a lot of experiences that people will describe their loved ones were talking to Uncle Jack, who's been dead for 10 years.
Right.
You know what I mean? That happens all the time.
You see that stuff all the time?
All the time.
Really?
Yes. That's very common.
Is it common for them to be seeing it physically, like in the room? Or
sometimes, not all the time, but sometimes, yeah. They do have some hallucinations. Most of the time it's more like they're in a very dream-like state, and they sleep a lot more. And so it could be that they're just having, very lucid dreams. And
what do you think that is? Do you think that they're actually seeing something, or that it's just a response and it's a hallucination of some sort?
I have my own spirituality, and I tend to think that it is a real spiritual thing.
Yeah.
But I think people have a lot of different beliefs about it, and regardless, I think it's beautiful. It
is wonderful. I mean, even if it is all just a hallucination, at least you are seeing that, and your brain's making you comfortable at the end.
Exactly. That's it's almost like that's your brain's way of making you comfortable.
It's like a built-in way of like
your loved ones.
Right.
Yeah.
Which that's a beautiful thing.
Right.
I hope that I get that same experience someday.
Yeah.
Even if it's all fake.
Yeah.
But have you ever seen anything personally, like in the room, or anything supernatural of the sort?
No, I haven't. Now, I have some pretty interesting stories, of lights flickering, but you can't really,
can't really pinpoint on a spirit.
No, you can't. But probably one of the craziest things that happened that really freaked out some hospital nurses. I had some nurses call me, and they said, this such and such patient passed away, and he was actively dying in the hospital. And so I made my way up to the floor in the hospital and to the room, and I walked inside, and the patient was breathing. And they said, no way, we called time of death.
Yeah.
Listened with our stethoscopes, everything, like 10 minutes ago. And I said, well, I think you should come in here because
I think you're wrong.
Yeah. Yep. And that's so that was interesting. Yeah.
Hey, that's why they used to put the bells on the coffins, and they would tie a string to the person's arm.
Yeah.
Because horror stories, talk about horrific. They would
my gosh.
dig up coffins, and there'd be scratch marks inside and stuff.
That's awful.
Oh, yeah. Thank God we don't have that problem anymore.
Right. No, we can know for sure, I hope.
Have you ever had a patient that has come back like that, and they're conscious to tell you about their experience of it or anything?
I have not.
No,
I have not.
Those always interest me.
Those are interesting, near-death experiences. I've watched some documentaries on that. That's pretty cool.
It's cool stuff.
I think especially for me as a hospice nurse, we're not trying to revive our patients, obviously, but I think those people who do have near-death experiences and were revived, they have some really interesting things to say. Yeah. So that's pretty cool. But yeah, I think that patient that came back to life was pretty interesting. Crazy. I'm not sure what was going on there. I think there was some theories about a funky heart rhythm that he may have gone into, and then just kind of almost resuscitated himself. So that's probably what happened.
It's shocking how resilient the body is sometimes.
Very. Yeah.
Even when you're dying, I'm sure you've experienced that where you're like, how is this person not dead yet?
All the time. Some people don't actually realize I have sat there with a person who hasn't been breathing for 30 minutes and their heart is still beating.
Really?
Not in a very effective way.
But it's still
but
there.
It's still, your heart's a very strong muscle, you know? So, yeah.
That's crazy.
It is. You really see the very limits to the human body for people, and everyone is different.
Yeah.
And you always get the question, you know, how long do they have? And I can make a very good educated guess.
You think you're pretty good at it now?
I mean, I've watched lots of people pass away in lots of different scenarios and with lots of different disease processes. So I can make an educated guess, but I'm not God. You know what I mean?
Yeah.
I am not divine. I can't really and truly determine that. But.
No, and weird things happen too, like you said, where the body will just keep pushing on against all odds.
Things that you just don't ever expect. So I tend to keep my educated guesses to myself.
What's your educated guess on me?
Yeah, I hope
Give me at least 40 years.
Yeah, I hope you've got at least 40 to 60 years in you.
At least 40 years. Yeah, my grandmother actually just passed away on hospice care a few months ago.
I'm sorry.
She lived to be 92 years old. And
good for her.
I know. And it was crazy how strong her heart still was at the end. Mm-hmm. You know, we were like, that's just crazy. She hasn't eaten in like a week or two.
Yeah.
And she was just had the strong heart. Her mind was completely there still, which,
good.
You know, is probably...
That's a treasure.
Exactly, yeah. So we were actually able to spend time with her around her bed or even out on the couch. We'd bring her out there, and she was able to spend time with us for like 2 weeks. And I'm like, this is almost beautiful in a sense that it ends like this. Like it's a perfect ending to a story.
Yes.
And that's kind of what you're providing, a perfect ending to the story.
That is exactly what we seek to provide.
Mm-hmm.
Yeah. We just want to provide some peace and a good conclusion, not a traumatic and restless and, you know, chaotic conclusion. I want people to have a positive conclusion to their lives, because there will be a conclusion, you know.
Now, that being said, there's probably people that come off of hospice too, against all odds. They make it out.
Definitely. There are some really cool stories that I've heard of people who were, you know, diagnosed with cancer, or a lot of times it's someone who was older and came out of the hospital with pneumonia, and they were just really bad off, and they thought, you know, this is probably the end, but then they just defied all odds and they got better and lived for 5-10 more years.
Yeah.
And that's awesome. We love to see that.
That's gonna make you feel great, you know.
Yeah, it does.
Seeing somebody walk out of there.
Yeah. There's been a study, you know, that I read once that said that on average or something, hospice patients who enter hospice earlier in their diagnosis live on average a month longer or something like that. So hospice is more therapeutic than I think we're given credit for sometimes.
Well, it's a scary word.
It is.
When people hear that word, they're like, oh no, that's the end.
Well, and I definitely think that some people have a negative connotation, rightfully so, because they had a bad experience. That's with everything, you know. There's some, I don't know, some people have poor experiences with hospice and get that in their brain is that's what hospice is. As soon as their loved one went on hospice, they died. You know what I mean?
And so they blame it on that.
Well, that's what your brain will associate it with. But again, the earlier they get on hospice, on average, the longer they live. And I think, you know, when I compare my experience in the hospital versus in home hospice, you've got, hopefully, in many cases, you know, 3 months or more to do some really hard work with that patient and that family and really prepare them. Mm-hmm. And in hospice, you have 30 minutes to do all of that. And that makes it's inevitably much more traumatic for that reason. Does that make sense?
What do you mean? Are you saying that in a hospital, if you go on hospice, you're going to die very soon?
Typically, yeah.
Okay.
Because the reason is when a patient is on hospice in the hospital, it is because they are in an actively dying process that, you know, they require IV medications, much more aggressive symptom management. And that has to do with, like, you know, we could get into Medicare regulations and things like that. But it's called general inpatient hospice is what occurs in the hospital. And that is for patients who are really acutely suffering.
So that's not your typical old person that has maybe 3 months to live.
No, I wouldn't say so.
It's always somebody in like a traumatic accident or something, and
it could be someone who is an older person who would have maybe benefited from hospice at home 3 months ago, but instead
and this is the tail end.
And this is the tail end, yeah, and they've ended up in the hospital, and it's like, oh, they've got a raging, infection, and they're septic, and they're dying right now, and so we need hospice right now. So sometimes it's because of that, and sometimes it is because of horrible accidents and really difficult situations. Yeah.
So being a nurse in a hospital, or hospice nurse in a hospital, it wasn't near as rewarding as being a home hospice nurse for you, at least?
I wouldn't say that. I would say that being a hospice nurse in the hospital was very rewarding. I got to be there for so many people in the hospital, and it was just such a difficult time in so many of those cases. I've had patients almost all ages, pass away on hospice in the hospital, and that is
tough to deal with.
Very tough.
Yeah.
But
how do you deal with it?
Good question.
You just are built for it?
Yeah, I guess so. I think it's just so important, and someone has to. I guess I just empathize with that.
It has to be
done. Those feelings that it has to be done, and they don't deserve to go through that alone. And I do have something to offer in that situation because I know how it works, and I know what I'm looking at when I walk into a room and I see someone dying, and I see the symptoms that they're experiencing, and I know how to treat that. And so, given that I have something to offer, well, I will go in and offer it. You know what I mean? So,
and you're a beautiful person because of that.
I thank you.
Seriously. I mean, to recognize that you have this skill set and this ability to keep people comfortable at the end of their life and use it, even though it might be hard for you to deal with on your own, that's a beautiful thing. You have a beautiful soul because of that.
I appreciate that. I think there are a lot of empathetic people who would do the same thing.
I would if I could be a nurse, but I could never be a nurse.
Yeah, it's a cool job, but it's not for everyone. That's for sure.
Well, you have to wipe asses, right?
That is part of it. Yeah,
that's the part. That's where I'm like, nah.
You know what though? Honestly, it doesn't bother me because it's part of human dignity, and I'm all for just protecting that. You know what I mean?
It doesn't bother you at all?
No, it doesn't. It doesn't.
Not even at the beginning?
Nope. It never did. That's how I knew I was okay.
That's how you know.
Nurse.
Yeah. Because me, on the other hand, I'm like, oh, no.
I'm like, it's okay. In the ER, old ladies would always come in and be so horribly embarrassed, and I just... It's okay, this doesn't bother me. I just want you to be comfortable and clean. So, yeah. That is part of it. But
that's part of being a nurse, all around, I guess, whether you're hospice or not.
That's part of life, too,
It is, unless you have a bidet,
Okay, yeah, fair.
Yeah, which we should be doing, America.
Yeah, we should be more like the French.
Let's get some more bidets out here.
Yeah, I salute that.
So, when somebody is on hospice and they're dying and they know that they're going on hospice, how do you treat their symptoms? How do you know how to treat them?
Well, you study the medications, you study the different disease processes that they're going through and what the symptoms are, related to that. And then at a certain point, there's only so much you can do because a lot of the medications that they've been using are not just for symptoms, they're for prolonging things. And so you kind of eventually, as things get closer and closer, you narrow it down to the things that are going to cover the most symptoms and be the most effective. And so, towards the end, you're often using 1 or 2 to 3, medications for all of their symptoms. So,
and it's just, is the primary focus pain management at that point?
Actually, pain is not always a symptom of dying. I would say that terminal restlessness is a term that you may or may not have heard that is associated with the dying process. That's something that people experience a lot. Anxiety, I mean, you can imagine anxiety, right? and then of course pain for a lot of people, especially with like cancer patients and stuff like that. Definitely. We have all kinds of ways to treat pain and all of those symptoms, but the pharmacist is my best friend. I call up a pharmacist all the time. They're some of the smartest people in the world, and they have so many tricks up their sleeve. You call yourself a good compounding pharmacist who has good experience, and they can come up with a solution for you to suggest to the doctor, I promise you.
Yeah.
So I've learned so much from pharmacists and from the medical directors that I've gotten to work with, and experienced hospice nurses. And
A lot of it is just like morphine and stuff.
A lot of it is morphine, Ativan, Haldol, yeah.
Just heavy drugs that'll keep you...
Heavy drugs
keep
that
the pain away.
Will keep pain, anxiety, terminal restlessness, all that at bay. People are sleeping a lot more, especially when they're actively dying. They're pretty much just unconscious. And so we don't necessarily worry about it making them sleepy at that point because, well, they're sleeping anyways.
Right.
But we want to give just enough medication to make sure that they're not feeling any symptoms. Obviously, at that point, or at a certain point, they cannot tell us how much pain they're in. And they cannot tell us, I'm feeling really anxious. So all we can go on is what we're observing. And so you have to train yourself on how to observe discomfort and what they may be experiencing. And you have to look into the different reasons that they could be experiencing something. Someone may exhibit a lot of, you have a dementia patient who may be experiencing a lot of restlessness and confusion. Well, that might not be active dying. It might just be a urinary tract infection. So you have to do some investigating. You have to look into that.
Give your best educated guess, at least, on what's going on.
Yep.
What if you have like an old cowboy in there and his last request is, I want a jug of whiskey?
Oh, I'd give it to him.
You would? Hell yeah.
Yeah.
Cheers to that.
Yeah.
That could be me one day. Give that old man his whiskey.
Yep, I support that. That's what I would want. Hospice is about choice in many situations. In hospice, you don't have to get out of your house and go to the doctor. You don't have to go to the ER where you have limited options.
Yeah.
You get people coming into your home, and they are asking you what you want. And you get to, it is your choice.
So you'll provide them with weird requests?
Well, I'll let their family provide them with some weird requests. I won't necessarily do that myself if it's not kosher, but,
Yeah, like a box of donuts.
I'm not going to go get the whiskey, but I'll go get the box of donuts, Get
the donuts?
Yeah, totally.
Pack of cigarettes?
No, especially not if they're on oxygen. I'll definitely not get the cigarettes.
Yeah.
Yeah.
I mean,
I had a patient who I think his cigarettes, even when he couldn't even take a draw on them anymore, it was way more therapeutic for him than me bringing oxygen into his home ever would have been. So I just never brought the oxygen in.
Yeah.
Because
that's
he
how you want to
didn't
go
want
out.
it, and he wanted his cigarettes, and that is fine.
That's how he wanted to go out.
That's how he wanted to go out. That's his choice.
He would have probably been cranky without him at the end.
I think so.
So yeah.
Yep.
Give the man his stogies.
Right?
Yeah. I'm all about that stuff, Let people go out how they want to.
Yeah.
In a certain sense, I guess.
Mm-hmm.
You don't want them to go out in a crazy...
In a painful way.
Yeah.
But I suppose if I can mitigate the pain in some other way and still allow them to do whatever it is that they love, then that's great, Now,
I've heard stories of people that are at the very end of their life and they'll get this second wind or whatever you want to call it.
Oh, yeah.
Where they're like fine for an hour or a couple hours.
A couple days even.
A couple days?
Yeah.
You've seen that yourself?
Absolutely. Yep.
What is that?
Good question. I have no idea.
They're like on the verge of death and then they just jump up and they're like, all right, let's get out of here.
Oh, yeah. I've heard some stories of hospice patients at my company who were actively dying, or seemingly so, multiple times, and then lived for, kind of came out of it and lived for weeks, months, even after that. So absolutely it happens. But it's very common. It's most common for them to do it for, hours to a day or so. And they seem to have just a good day that you weren't expecting, and then and then you really see the decline after that.
Yeah.
That's a pretty common pattern.
Yeah. I've heard a story. I think it was one of my buddy's uncles or something like that. He was dying of cancer, and he was like on his deathbed, just very unresponsive almost.
Mm-hmm.
And then one day he got up and he was like, "Oh, I feel fine. Let's get out of here." And then he died a few hours later.
Yeah. Yep.
And it was just like, I don't know how to explain that really, or what that is, but maybe it's that body's natural response of just like.
I think maybe it is like it could be like a panic in the brain, like, oh my gosh, I have to do something, right? Like, here I am laying here doing nothing, and this is happening. We got to do something. We got to get up.
Jump up and get out of here.
Operate normally.
Yeah.
A lot of times if a lot of times people say, I need to get out of bed, I need to get out of here, I need to go somewhere, and that they're very restless, and that's a good example of terminal restlessness, so it could be related to that in some way.
Yeah, I could see that.
But some people are very calm about it, so I'm not really sure.
It just differs person to person, I guess,
It really does.
Like, my grandma was completely accepting of dying. She was ready to go. I mean, she was completely fine with it. She never complained once or anything, so.
Do you have a big family?
I do, yeah.
Yeah.
We have a big Catholic family.
Well, there you go. So do I.
Yep. So plenty of kids and grandkids around her, which was great.
Yeah.
But then on the other hand, I know there's people that are just terrified of death, even at the very end, which sucks.
Yeah.
But
it's always wonderful to see big families, though, when they're able to support that loved one when they're at a terminal stage. And it's just, it really is a beautiful time.
Yeah.
It's difficult for everyone, but it's beautiful when everyone's able to accept that and support. And I think those who fear it more, it's often related to a lack of support in those situations. So I'm really glad that your big family was able to support your grandma.
I am too. Yeah, it was a beautiful moment.
Yeah.
Sorry, go ahead.
No, I was just gonna say I think those who have less support, I think it is a lot scarier for them.
Oh, I can imagine. Yeah. Nobody's there to comfort you at the end.
Definitely.
Have you ever had to give hospice to somebody that was a terrible person, or?
Oh yeah.
Yeah.
Yeah. No, I don't know that I want to go into that.
You don't have to if you don't want to.
I hate to admit that.
But there's people of all types, and you're gonna have some horrible people sometimes.
Yes, but I don't think anyone deserves to die uncomfortably. So no matter who they are, and I try to just live by that and be unbiased in that. And
if they're treating you like garbage, though, do you ever kind of wish it goes a little quicker?
Well, I think if they're treating me like garbage, I would at least stick up for myself a little bit in a respectful, professional way. And of course, they're not going to be allowed to be abusive to the staff. That's not okay. But most people are rather accommodating and nice to their hospice nurses. So
most people,
yeah.
But it's got to be weird trying to keep somebody comfortable that's being mean to you.
A lot of times, if they are being mean to me, it's because they're disoriented, though.
Oh yeah.
So I can definitely console myself with that fact. Like they don't really know what they're saying. Maybe they aren't really angry and pissed off at me today, but.
Just don't take it personal.
Yeah, no, it's not personal. They're going through something way bigger than whatever issue they see with me. So I think if they need to hyper-focus on an issue that they have with me, that's fine. If that helps them, fine.
That's a good way to look at it.
Yeah.
Have you ever dealt with, like, terrible family members, too, that are just either refusing to accept that their family member's dying, or they're mean to you for some weird reason?
Yeah, definitely. It's hard for people.
What do you have to do in those situations? Do you have to just talk as much sense to them as you can and hope that they understand?
You try to be as empathetic as possible. You do try to, talk to them logically and empathetically, and there are some people who never will, and you have to accept that. One thing, when I started hospice, a social worker said this to me. She said, people die how they live. And I have remembered that for the entire time that I've been in hospice, because I think it's very insightful. People who choose to foster chaotic relationships and, just poor relationships with their family and stuff, or they live in a disgusting household, or, whatever whatever situations that people live in, if they choose to live in that, they're also going to die in that.
That is so like poetic, you know, the way that happens to people in life. I mean, it really does come full circle.
Yeah.
You're seeing that firsthand.
And as a hospice nurse, I can't go home and think, you know, oh, I have to, you know, I failed in saving them from their situation. I failed in helping them mend relationships or something like that. That is not possible most of the time. That is the life that they chose. And for the same reason that I would allow that old man to drink his whiskey, you know, I'm going to allow people to have the relationships that they choose to have.
It really is wild. I mean, it's, you know, it doesn't seem like it would work out like that because most people just think that life is random chance and it just ends up how it does. Mm-hmm. But in your setting, you're seeing firsthand that things really do come back around to get you if you live in a terrible manner.
Yeah.
You know, that's interesting and that's poetic, you know, the way that works.
Yeah.
It's a real thing.
God works in funny ways.
Yeah.
Yeah.
Do you ever have family members that are just going against the patient's wishes?
Yes.
Like the patient is dead set on going this route and the family is just like, no, we don't want that. They don't know what they're talking about.
Yeah. It's pretty heart-wrenching for sure, especially when the patient is, you know, fully aware. And a lot of times you see situations where the patient is accepting, but they are going through aggressive treatment still because they want to appease or they don't want to upset their loved one. That's hard to watch too. I think it's because they mean well, you know. But again, we go back to that as humans we grieve selfishly thing, and that's exactly what's happening there, you know. And I can't fault them for that. I can just do my best at doing my job and having those goals of care conversations and being very logical about it and just being honest about the outcomes. I've never had anyone be upset with me for being honest, even when that honesty is very harsh, because I always tell them, you know, I'm not trying to be insensitive when I say this, but, you know, if you go this route or that route, this is how it's likely to end up. And they never get upset at that honesty.
Yeah, just making it aware that your interest is not to fool them or take or hide anything. I mean, you're just doing...
Everyone can appreciate honesty.
Yes.
Yeah. So
even if you're mad at the answer that you're getting.
Oh, absolutely.
And
you have, you know, I've had people yell at me and stuff like that, of course, over the whole situation and how upsetting it is for them. But usually they end up, you know, kind of circling around and realizing, you know, I'm just trying
apologizing.
Yeah, and they
like
do.
I was
they
out of my
do
element. I was acting out of emotion, which they all are.
They absolutely, and that's okay. It's not fun, but it's okay.
That's why you gotta let that stuff just bounce off you.
You do.
You know.
You cannot take it personally because it is not. It's about so much more than me. It's not about me at all. So yeah.
So you're dealing with these people at the very end, and a lot of them are conscious still. You said. So I'm sure you hear a lot of like last wishes or last advice. Do people talk about regrets that they've had in their life?
You know, I don't know that that's a very common conversation that I have with them. I think I love to ask them about what they did with their lives and their family and things like that. And I do hear some people talk about, you know, how they regret not mending this or that relationship or something, or they regret this one time they did that and it really hurt so-and-so or something like that.
Are there any common regrets that you've heard multiple times that older people have especially?
I think it usually has to do with relationships with loved ones.
Yeah.
Yeah, I think, and I'm sure we can all relate to this, I think we all get upset and selfish and get into situations where we break ties with people, or we
hold a grudge on somebody forever.
Hold a grudge on someone, and it's.
Then you end up on your deathbed, and you look back and you're like, "Wow, that wasn't." Yeah, what the hell did I do that for?
It's like
it meant nothing.
Yeah, a lot of people will say, you know, I really wish so and so was here. I could use their support right now. So yeah,
Pretty crazy
it is
to think about. Gives me motivation to just never hold a grudge or
right.
anything.
I know, yeah. You definitely look at relationships in life differently when you are around death all the time.
What about advice? Do you ever get any advice from these older people that say, live a certain way or do a certain thing?
I ask them a lot, especially I think the oldest patient I ever had was 104. So I like to ask those people, what's your secret to longevity? The women will tell you to moisturize, and
will they?
Yeah, the old men, the old farmers will, tell you to drink beer or whatever. They usually give you some crack up advice. It's kind of funny.
Coors Light.
Yeah,
for me.
something like that, or just work hard, and some of them have some really good sincere advice. And I recently got married, so I like to ask a lot of them, how long were you married and what's your secret and stuff like that. We get some good advice for that. So.
Yeah. People, 100 years ago definitely viewed that as in a different way than we do today.
Definitely.
They
I
stuck
think
through the hard
to learn.
times.
Yeah.
They just had a totally different outlook.
For
and
sure.
it's fun to hear their stories on that and how they made it through, and even some of the hard times that they've gone through. Mm-hmm. Like my grandma, she was still saving plastic bags from Walmart and reusing Ziploc bags and just stuff that was ingrained in her from like the Depression era.
Yeah.
And we have no clue what that's like.
Yeah, no.
We can buy whatever we want right now.
Absolutely no reference, except during the pandemic, toilet paper, that was a bit of an issue. But
but once again, bidets.
Yes,
that's where that comes into play.
The French, they know what's
It's
going
not just
on.
the French. I mean, you can get them in America, and people need to know that.
You can even get little attachments.
Little attachments, yeah.
Consider
$40.
this an ad.
I'm going to be sponsored by a bidet company one of these episodes. I promise. You just wait. Okay, well, let's talk a little bit about how the life of a hospice nurse differs from a normal nurse.
Okay. Well, where do I start? I think with hospice on the home side, I have a caseload of patients. And so I'm responsible for seeing them on a routine basis. And then, at those routine visits, I'm documenting and assessing their decline if it's happening, which presumably if they're on hospice, it's happening. Mm-hmm. And preparing the family, educating on what's to come, and working with the other disciplines like the chaplains and the social workers to prepare them. They like to make funeral arrangements ahead of time and things like that, and just hoping to foster precious moments.
Those are all things that a normal nurse doesn't really have to deal with.
I mean, for a normal nurse, that's not really your focus at all. A normal nurse is focusing on trying to improve.
Yeah.
A normal nurse is focusing on trying to, of course they want them to have quality of life, but when you're a nurse in a hospital or a home health nurse, you're trying to improve.
It's about recovery.
It's about saving lives.
Mm-hmm.
And so it's a totally different avenue that we're going down.
What about the workload itself? Did you find it was more hectic being just a nurse on the hospital floor or being a hospice nurse? And what does your day look like hours-wise and all of that?
In the hospital, I was working 8 a.m. to 5 p.m., but there was an on-call team that would be, backing me up. There were some days that I had to work late and stuff, of course, but it was Monday through Friday, so that's a different thing. Hospital nurses usually work 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m., and it's 3 shifts a week, and that's a full-time job for them. And that is very tiring work. For a hospice nurse in the hospital, I would show up first thing in the morning, and I would maybe go see my patients who were still alive if I had any, and then I would just wait for the call for someone else. And there were days where I had 6 patients, and there were days where I had 1 to focus on. So definitely some crazy days and some more mellow days. Some days where even if there were 6 patients, I needed more backup because I couldn't focus on all of them, because 1 patient was really, really a tough situation and I needed to focus on that. So I don't know. It's a very unpredictable caseload, to be honest with you. It's a really, really unpredictable workload.
So that's a difference. That's a
Yeah.
big difference there. What about, like, as far as schooling and everything goes, you went to nursing school, I'm assuming?
Mhm.
And that's just your normal 4-year degree?
Same thing. Yep.
Same thing as other RNs?
Yep. I got a BSN. So for an RN, you can either have an associate's or a bachelor's. And I went the bachelor's route. And then there's no, you can get certified as a hospice nurse, but you actually have to work over, gosh, I think it's like 500 hours as a hospice nurse to even take the test for that. So
Oh, really?
yeah, you have to study a lot and work a lot before you can even get
What about
certifications like that.
What about requirements as far as just being a hospice nurse at all? Can you go to hospice right out of the gate?
You can.
Right when you graduate?
Yep, you
Okay.
can. It's not usually something that's done. I'm
Yeah.
definitely one of the younger nurses at my agency. I think I might be the youngest. That wouldn't surprise me. And it's not very common. In nursing school, you get maybe a paragraph of information about hospice. I honestly don't even remember that paragraph. So it's just not something that you learn about in nursing school. So you really have to do a lot of on-the-job training.
Yeah.
Yeah.
And was that very difficult at all for you, or did you breeze right through it?
Of course, it's difficult to learn about the different disease processes. It's a lot of work, and I think you just have to refer to all the other people that are supporting you. Luckily, in my company, and I think in a lot of, hopefully a lot of hospice companies, it's just a very supportive environment. Everyone leans on everybody else, and there's all these different, it's the hive mind, if you're having a difficult situation, you don't know how to control this patient, I'll call the pharmacist, or I'll call the doctor,
Yep.
or I'll call this hospice nurse who's really experienced, and I think she had a patient like this, or I'll just text the group text and be like, hey, this is what's going on.
Somebody
Any
chime in
tips?
here.
Yeah.
Do you ever get compassion fatigue, like going from patient to patient and just having to be on point all the time?
Yeah, definitely. But I think at the end of the day, I go home and I kind of
Unwind.
decompress, and it's okay. But I
Yell at your husband, like, stop it, I'm done being nice today.
no, I hope not. But no, I think I'm not sure where it goes, but it goes somewhere, and it hasn't really presented much of a problem for me on the compassion side. Work fatigue, sure, it's tiring.
It's tiring work. There's some physical labor going on there.
A little bit, at least.
Turning them over and stuff
Running
like that.
around the hospital.
Running around the hospital, yeah.
Yeah. But I realized once, like, I don't, sometimes I go home and shed a tear for these people, definitely. Or even with the family, a tear or two.
Yeah, I'm sure you grow close to them sometimes, and you get to know them.
You get attached to people. But at the end of the day, I don't seem to lose sleep over them. But one day, I lost my stethoscope in the hospital, and I left it after, using it to call a time of death. I left it in the room, and I didn't realize, I think I did that on Friday, and I realized on a Monday, and I was devastated, and like I'd never been before.
Just tore you to pieces?
It did. I thought, oh my gosh.
Was that because of a buildup of a lot of other stuff?
Well, I think it was, I just kept thinking to myself, do you know how many, times of death I've called with that piece of equipment right there?
Yeah.
Like, and that hit me. I was like, I can't even count.
That's crazy.
Yeah.
Yeah, you had an attachment to that.
Yeah.
Just because of what you've gone through with it.
That's my tool, and I found it. So we're good.
There you go.
I was so happy. One of the ICU nurses had taken it out of the room and put it in a drawer for me. So I went, and right outside the room there it was. I was, thank goodness.
Yep, that's a relief.
Yeah. So there's definitely it goes somewhere emotional, but it doesn't seem to affect me, probably just because I'm there for a very specific purpose.
Mm-hmm.
And
your heart is in the right place. You're there for a reason, and your reason is to keep these people comfortable at the end of their lives.
Yeah, and I know that it's the end for them, and that's okay.
Yeah.
You're
very resilient. your mind,
Hope I stay that way.
and you have to be in
Yeah.
this job.
Mm-hmm.
And that being said, what would you recommend to anybody out there that's considering this career path?
Boundaries. I think you have to have healthy boundaries. Of course, you want to be empathetic and you want to be there for people. You want to feel their emotions to some degree, but you don't want to take that on for yourself. Does that kind of make sense? Like, you don't want to take that home and feel as if you have some responsibility for their emotions. Because what they're going through, I think I've said it before in this conversation, it's not about me.
Exactly.
And I have something to offer in that situation, but I can't fix everything. People are going to die how they lived, and I can't change that, but I can, offer what skills I do have to make them comfortable, and I will do my very best. But at the end of the day, I am finite.
You leave your work at work.
Yes.
And that's probably something important for people to know if
Yep.
they're going to be a hospice nurse, is keep work at work.
Yeah.
And don't carry that baggage home, like you said.
Exactly. Yeah. Have a very strict line of this is when I work and this is when I'm at home and I have my personal life. So
That's good stuff, Katelyn. You are a beautiful soul, like I said earlier. And you're
you.
doing God's work out there. You're helping people out in the worst time of their lives and the worst time of their families' lives.
well, thank you for giving me the opportunity to tell people about that as a career and as a service for people.
It's a crazy career. It's wild. I mean, there's nothing else really. There's not a lot of other things out there that are like that.
Not really. No.
And God bless you for being so resilient and being able to do that job day after day,
Thank you.
because we need that.
Yeah.
I want a nurse that's helping me out on hospice when I'm dying. I don't want to have nobody around.
Right. I do too.
So it's like, it's such an important job, but it's also such a weird one, and one that you probably have to be a little bit mentally tough for.
I guess so, yeah. I haven't really thought about it as mental toughness. I always thought about it as you have to be a little softy. You got to be a little empathetic. But yeah, you do have to have a little bit of mental toughness, I guess. So
Yeah. Well, thank you for what you do, and keep doing the great work out there.
yeah,
Keep
happy to
spreading the
do it.
word. Keep just keeping a positive attitude and being compassionate to everybody.
Will do.
Thank you so much, Katelyn. And any last words?
Thank you. I don't know.
Yeah. Cheers. Let's drink
Yeah.
some root beer.